Imagine waking up one morning, reaching for your phone, dialing Social Security, and realizing no one is there to answer. No office doors open, no live agent on the line, no in-person help, not even for emergencies. For millions of Americans who depend on Social Security to survive, this isn't just inconvenient. It's terrifying, because in just days, the United States Social Security Administration, one of the most critical lifelines in the country, is going completely offline for a full 24 hours. Why is this happening now? Who will be affected the most? And what does this shutdown reveal about the fragile system tens of millions rely on every single month? Stay with me, because the real story behind this one-day shutdown goes much deeper than you think. The Social Security Administration, commonly known as the SSA, has officially confirmed that all of its thousands of offices across the United States will shut down for a full 24 hours. This means no in-person services, no live phone assistance, no walk-in help at local field offices, no hearings, no face-to-face support. The shutdown will affect roughly 74 million Americans who receive some form of Social Security benefits, including retirees, disabled individuals, survivors, and low-income families. The agency says this closure is scheduled and temporary. But for people living check to check, timing is everything. And this timing couldn't be more sensitive. Social Security isn't just another government program. For many Americans, it is the difference between stability and crisis. More than half of retirees depend on Social Security for at least half of their income. For millions of disabled Americans, it's their primary source of survival. For widows, widowers, and children, it's a lifeline after loss. So when the SSA shuts its doors, even for one day, the ripple effects are massive. Missed appointments, delayed claims, unanswered emergency questions, confusion, fear, and frustration. And that's exactly why this announcement has sparked widespread concern. To understand why a single day matters so much, you need to understand how large and how fragile the Social Security system truly is. The SSA operates approximately 1,400 locations nationwide. These include local field offices, processing centers, hearing offices, administrative facilities every single day. These offices handle new retirement claims, disability applications, appeals, and hearings, address and payment changes, benefit verifications, fraud investigations, emergency payment issues. Behind the scenes, the system is already under intense pressure. Staff shortages, outdated technology, a growing elderly population, record numbers of disability claims. Even on a normal day, wait times can stretch for hours, sometimes months. Now imagine pressing pause on all of that. According to the Social Security Administration, this 24-hour shutdown is part of its scheduled federal holiday closures. The SSA shuts down around 11 times a year, typically for major federal holidays. Earlier this year, offices were closed on January 1st for New Year's Day. The upcoming closure is tied to another federal observance. On paper, this sounds routine. But here's the problem. This isn't happening in a vacuum. The U.S. economy is under strain. Inflation has squeezed household budgets. Medical costs continue to rise. Housing costs remain high. And Social Security recipients are already anxious about benefit changes in 2026. That's why this shutdown hits differently. For someone waiting on a disability decision, for someone whose payment hasn't arrived, for someone trying to fix an error before rent is due. One day isn't just one day. It can mean late bills, missed medications, eviction notices, food insecurity. And that's what critics say policymakers fail to understand. Let's be very clear about what shuts down and what doesn't. What will be unavailable? All local SSA field offices, all in-person appointments, live phone support from SSA staff, hearings, and office-based services. If you walk into an SSA office on that day, you'll find locked doors. If you call the SSA helpline, you won't reach a live representative. What will still be available? Online services through the SSA website, automated phone systems, certain self-service tools. But here's the catch. Not everyone can use online services. Millions of Social Security recipients don't own a computer, don't have reliable internet, aren't comfortable with online forms, have disabilities that make digital access difficult for these Americans. In-person help isn't a luxury, it's a necessity. Advocacy groups have long warned that pushing everything online leaves the most vulnerable behind. And this shutdown puts that reality front and center. Let's talk about who is impacted the hardest. Retirees. Many seniors rely on local SSA offices for benefit explanations, Medicare coordination, survivor benefit questions address, or banking changes for elderly Americans, especially those living alone. A closed office feels like a closed door to security. Disabled Americans' disability claims are complex. Appeals are stressful. Hearings are emotionally draining. Missing even one scheduled interaction can delay benefits for weeks, sometimes months. Low-income families. For families receiving supplemental security income, timing is critical. A delay can mean no groceries, no transportation, no childcare. Immigrants and non-native English speakers. In-person assistance is often the only way they can navigate the system. Online forms don't replace human help. As news of the shutdown spread, reactions flooded social media and community forums. Many expressed confusion. Why now? Why not keep emergency staff available? How are people supposed to survive delays? Others expressed anger. They argue that Social Security offices are already understaffed and overwhelmed, and shutting them down, even temporarily, makes the problem worse. Some defended the closure, saying federal holidays are standard and staff deserve time off. But even among supporters, there's a shared concern. The system is stretched too thin. This shutdown comes amid growing anxiety about the future of Social Security itself. In 2026, some beneficiaries will see payment schedule shifts. Others may face benefit recalculations. Concerns about long-term funding remain unresolved. Trust fund depletion warnings continue to circulate. Political debates over reform are intensifying, and every disruption, even a one-day closure, fuels fear about what's coming next. Policy analysts say the real issue isn't the holiday closure. It's the lack of flexibility. Experts argue that the SSA should have emergency in-person options, limited live phone support, clearer public communication, better contingency planning. They warn that as the population ages, these disruptions will become more damaging, not less. Here's something rarely discussed. SSA employees are also under enormous pressure. Caseloads have increased. Staffing levels have dropped. Burnout is rising. Many offices are operating with fewer workers than they had a decade ago, despite serving more people. So this shutdown isn't just about beneficiaries. It's a symptom of a system under strain from every direction. If you or someone you know depends on Social Security, here's what experts recommend. Handle urgent matters before the closure. Use online services. If possible, avoid scheduling critical deadlines. On shutdown days, monitor your payment status. Early preparation can make the difference between inconvenience and crisis. After the 24-hour shutdown, offices will reopen, but the backlog won't disappear. Missed appointments will need rescheduling. Delayed calls will pile up. Processing times may stretch longer. And unless deeper reforms happen, this won't be the last disruption. This isn't just about office hours. It's about trust. Trust that when Americans need help, someone will be there. Trust that a lifetime of work will be honored with stability. Trust that the safety net won't suddenly vanish, even for a day. For millions, Social Security isn't a line item in a budget. It's survival. So when the doors close for 24 hours, the question isn't whether it's scheduled. The real question is this: can America afford even a single day without its most critical safety net? Because for millions of families, one silent phone line, one locked door, one unanswered question can change everything. And that's why this story matters. Today, tomorrow, and far beyond this shutdown. And this is exactly where the story doesn't end. It actually gets more serious. Because once the Social Security offices reopen after those 24 hours, the damage doesn't magically disappear. It lingers. When SSA offices open their doors again, the system doesn't reset to zero. Instead, employees walk into overflowing voicemail boxes, thousands of missed calls, canceled or postponed appointments, angry, confused, anxious beneficiaries. Every shutdown day creates a silent backlog, and that backlog hits hardest in the days that follow. A senior who missed an appointment now has to wait weeks. A disability applicant pushed back in line loses another month. A survivor benefit case sits untouched. And here's the part most people don't realize. The Social Security system was already behind. For years, internal reports and watchdog groups have warned about growing pressure inside the SSA. Consider this: the number of beneficiaries keeps increasing every year. The workforce handling those cases has not grown at the same pace. Many offices are operating with skeleton staff. Some rural areas have lost offices entirely. So when a full nationwide shutdown happens, even for one day, it hits an already fragile system. Think of it like traffic on a highway. If traffic is already slow, one small accident can cause miles of jam. That's exactly what happens here. For people with savings, a delay is annoying. For people on fixed income, a delay is dangerous. Many Social Security recipients live on extremely tight budgets. Rent is timed to benefit deposits, medications are refilled based on payment dates, groceries are planned down to the dollar. If even one issue goes unresolved because an office was closed, the ripple effect can last weeks. And that's why advocacy groups say timing is everything. Statistics don't capture stress, but talk to beneficiaries, and you hear the same emotions again and again. Fear, helplessness, frustration, exhaustion for seniors living alone. Social Security offices are often the only direct human connection to the system. For disabled Americans, each interaction can feel like a fight for dignity. So when that connection is suddenly cut, even temporarily, it takes a psychological toll. People feel forgotten. That's one of the most common questions being asked right now. Critics argue that hospitals don't shut down, emergency services don't shut down, utilities don't shut down. So why does Social Security? The SSA's response has historically been that federal holidays apply across agencies and staffing rules limit operations. But critics say this explanation no longer fits reality, because Social Security isn't just an agency, it's infrastructure. What's striking about this shutdown is how quiet the political response has been. No emergency statements, no major press conferences, no reassurance campaigns. And that silence sends its own message. It suggests that disruptions to Social Security have become normalized, and that worries policy analysts. Because once something becomes normal, it stops being urgent, even when millions are affected. Officials often point to online services as the solution. But here's the reality. Many beneficiaries struggle with password recovery, two-factor authentication, complex online forms, accessibility barriers for a 75-year-old retiree or a disabled individual with cognitive challenges. Just go online isn't helpful advice. And every shutdown pushes more people towards systems they may not be able to use. This one-day closure is part of a pattern of reduced in-person access, longer wait times, greater reliance on automation, less human interaction. Experts say this points toward a future where Social Security becomes harder to navigate, not easier. And that raises a critical question. Is the system evolving to serve people, or simply to survive under pressure? If current trends continue, experts warn of more frequent service disruptions, longer processing times, greater backlogs after closures, increased frustration among recipients. That doesn't mean benefits are disappearing tomorrow, but it does mean access is becoming more fragile. Many viewers might think, this doesn't affect me yet. But Social Security touches nearly every American family. Parents, grandparents, disabled relatives, surviving spouses, future retirees, and one day, it may touch you. The system you see today is the system you'll inherit tomorrow. This shutdown forces a larger conversation. Should essential services ever fully close? Should Social Security be treated differently than other agencies? Should emergency access always exist? These are uncomfortable questions, and they don't have easy answers. But avoiding them doesn't make the problem go away. So when the Social Security Administration locks its doors for 24 hours, it's not just about a holiday. It's about what happens when a nation pauses support for its most vulnerable, even briefly. It's about seniors counting days on a calendar, disabled Americans waiting on decisions, families praying nothing goes wrong on the wrong day. Because in a system where millions live on the edge, one closed door can echo far longer than one day. And as this shutdown passes quietly into history, the real question remains unanswered. When the next disruption comes, will the system be stronger or even more fragile than before? That's the story behind the shutdown. And it's far from over.